Uganda, a country with a heavy burden of mobility and mortality, faces a critical shortage in the healthcare workforce to meet the needs of its ever-growing population. Despite the growing population, the number of healthcare workers is very low. For example, for every close to 3,000 people, there is only one healthcare worker to take care of them. This denotes the importance of utilizing the village health team members to provide basic health interventions in the communities. Uganda's healthcare system, led by the Ministry of Health, follows a structured referral model from health centers to district, regional, and national hospitals. Despite the fact that the system is designed to bring care closer to the people, it continues to face challenges like limited resources, overworked facilities, and uneven access, especially in rural areas. At the heart of rural and community care are the village health team members, dedicated volunteers identified by the communities who serve as the first link between the healthcare system and the people it's meant to serve. VHTs serve as frontline heroes for community healthcare delivery, often engaging in provision of services such as testing and treating of common diseases like malaria, diarrhea, and more, referring serious cases, following up on patients, tracking lost clinic clients, driving health education, immunization, and outreaches within their communities. Here is what Anthony Ochen shared with us about his motivation to be a VHT member.
You know, your miracle me or that of VHT, and a nail quick, you can gang, Marvel, the yellow community come out here. Don't query me to the toilet, shut up, Carmel year, a year, maybe VHT.
When we spoke with the health center in charge about the role of VHTs, this is what he had to say.
We engage them in various activities which are more based in the community, among which follow-up of clients who are on chronic. And also they help in mobilizing the clients to utilize the services, more so the community-based services. The community outreaches like for immunization, mobile ANC, and many others. And also they help us in mobilizing mothers to come to the facility for antenatal care early enough, and also reminding those who might have missed to attend antenatal care to come back and attend in time. We have also other VHTs who distribute drugs at the community, and they manage simple ailments like pneumonia, diarrhea, malaria, and also testing malaria. They get their medicines on quarterly basis, and they report to the facility, and we also submit a report to the district, which is entered into the DHIS2.
The VHTs in Amuru District are organized through the Amuru Village Health Team Members Association, as described by Alfred Odoch, the coordinator of the association.
I am Alfred Odoch, the VHT coordinator for Amuru Village Health Team Association. The association started in 2009 with help from my Dr. Mike, that is Michael Westall, and his wife, Andy Pennigan. With support from Lacho Hospital, the association was started to support the VHTs so that they are able to get support in their work as VHTs.
The works of the VHTs in Amuru District have in the past been supported by the Bikes Not Bombs project, which facilitated VHTs with bikes to ease their mobility, as described by Alfred Odoch.
Through the association in 2012, we were able to get bicycles, one container full of mountain bikes, to support the work of the VHT. The bicycle was brought in by Bikes Not Bombs, based in Boston, USA, to support the VHTs. And also in 2013, we were able to construct the bicycle store, this store you're seeing now. This was to sustain the bicycle, to help repair the bikes, to see that the bikes are on road.
The bikes demonstrated impact such as VHT effectiveness, big household coverage, reducing the time it takes to visit homes and facilities, and overall VHT and community satisfaction. This is what one of the VHT members had to share.
Kamu kene tie ke age kan mesiro kunu tie sok kilometer pia vero. Ma ini na chela I wana timing mo chire ilimo dok on marama vero nyu dok on marama beach. Manu bela tis engelela manu wana no.
This is what the facility in charge had to say.
So as you can see, VHTs, most of their work involves a lot of movements. And bicycles are very vital in facilitating their movements. These VHTs also, they have other works to do, and since this VHT work is a voluntary work, they give in part of their time to do it alongside their routine activities at home. So the bicycles will save their time as they finish their other work like garden work. They give in their time and the bicycle will fasten their movements in the community.
This is what one of the community members had to say.
When the VHT have been performing their tasks or duty with the bicycles, they used to have a number of visits in our home visits. Like in a day, one can take a visit of 7 home. They used also to do some other sensitization processes for immunization. And actually by then they were so effective in performing their tasks. They used to visit us. They used to respond to us in time.
However, due to population growth, deterioration of bikes and lack of replacement resources have eroded these gains, reintroducing a mobility gap that limits health access and equity in Amuru. These were exacerbated by the effects of COVID-19.
Looking at the economic status, when we were hit hard by COVID-19, the VHTs were unable to repair the bikes. So VHT bikes are off-road now. Most of the bikes are off-road just because VHTs are unable to get financial support so that they are able to bring back their bikes on road. We need help, is that we need really help to restock the workshop, the bicycle workshop, because we have some tools that are worn out. We also need bikes for the VHTs. We have other VHTs that are trained after the bikes were distributed, so they didn't get bikes. Some of these VHTs who got bikes, their bikes are also worn out.
The facility in charge further elaborates on the impact of the breakdown of the bikes.
Since the breakdown of the bicycles, the VHTs, their mobility has been much affected. And you find the coverage where they were supposed to cover a given area, they are unable to cover it effectively. Even the rates of reporting has reduced because most of them have now kind of abandoned some of the areas.
This is where CareConnect Amuru comes in, a project designed to enhance health equity in rural Uganda by addressing transportation barriers of VHT members. We will do this by replacing the broken bikes and purchasing or importing the bikes and distributing them to VHT members. because when a VHT has a bike, healthcare reaches faster, further and deeper into the community.
If VHTs have bikes, they can do more work. If VHTs have bikes, they can save life of children. They can save life. I tell you, if VHTs are supported with bikes, the community health will improve.
Join us in causing this life-saving impact. Together we can improve Amuru community. One bike, one VHT, one life at a time.